Hello and welcome to this episode of Our Longevity Futures. I'm your host, Chris Kerwin, and today I'm delighted to speak to Vasily Zlotov. Vasily is a CEO of Artis Electronics, a company that is behind the design and the development of the NOTA mole tracker, which is what we'll be talking about today. So welcome, Vasily, and thank you very much for joining me.
Thank you very much for inviting. Pleasure to meet you.
So I'll jump straight into the questions. And can you tell me a little bit more about what the skin tracker actually does?
Our skin tracker based on bioimpedance technology. You possibly know this technology from smart scales, which you can meet in every fitness center now. Based on this technology, we compare the healthy skin and the problem skin, and the difference of bioimpedance shows different process happens with your skin. Our technology is created to detect abnormal situation, including cancer, happening with the skin, and giving the possibility of users for very early diagnostic. Because we do not need to, our users do not need to visit doctor for that. They can do that at home. We do not make a diagnosis, but we give a possibility for user to see is it red or green zone. Do you need to worry and emergency go to the doctor?
So how does that actually work? So you mentioned that it's a home device, so you don't need clinicians to actually administer it. Can you just talk us through how someone at home might use it to actually detect cancer?
The difference between impedance of normal skin and, for example, cancer skin.
So when you say impedance, what do you mean by that?
We move very soft electricity, which comparing with electricity generated by our own body, so it's completely safe. For example, for pregnant people, it's completely safe for different other people. Comparing with different methods. This electricity moves from the cell and gives the response. And we see this is normal response, this is not normal response. In this case, we can recommend people to visit their doctors and receive a special treatment or research of the situation. And for now, this is very interesting method because, of course, we have necessity to visit doctor, for example, once a year. But between two visits, it could happen everything. And the more early you detect problem, then more successfully you can treat it. So we are not going to become a silver bullet. We are not going to solve all the problems, but we raising a chance to detect the situation, the wrong situation in very early stage. And this technology is it's very interesting because it's completely safe. We do not make any invasion to the skin. We do not harm it. So it is very good for person to have possibility at home health self-diagnostic methods.
Yeah, I completely agree. I mean, having that ability to do that at home makes a huge difference. But how accurate is something like the skin tracker?
You see, for now, it is very hard to say about the real numbers. We have very limited amount of persons, and we have very limited amount of research. For now, we have about 80% of right diagnosis. But I can tell it's very, very careful because, of course, for real numbers and for real research, we can do it only on late stage with normal procedure for examination in medical institutes and so on. So for now, it is now we can say that it is very interesting method because first of all you you can do it much more regularly than, for example, visiting professional doctors and making a biopsy or X-ray diagnostic. No, you cannot do it every week. And with our method, you can do it, for example, every week if you have some doubts and temptations. And the more that you use, the more it is possibilities you have to detect.
And I presume that you had to train the sort of machine learning algorithms behind it on a particular data set. So I was just wondering what that data set was and how diverse were the actual images that you were training the data on?
You see, this technology is very interesting. It is known from 60 years of previous century. But what this technology do? We have several electrodes. The electricity goes between them, and we actually do not have some kind of a picture. We have a lot of electricity moving with different diapasons, and it is on NOTA skin tracker. It's dozens of these electricity, let's say, screens. And we have more complicated devices for future. For example, we have some same device for now preparing for melanoma tracking. Oh, not melanoma, breast cancer tracking, sorry. And this device have 64,000 of calculations, 64,000 of images. And of course, these technology are very interesting, but it's impossible to use by a doctor. We have much more comfortable things like UZI or dermatologist, which is possible to use by one person. And this technology is really works only with machine learning, because you can operate with all of these information same time. That is why this technology is not very good to use with specialists, because in that case you will need to create absolutely different specialization in institutes, and it is not worth it. But with machine learning, then you can operate with really big data, and these numbers are not a problem. It opens absolutely new possibilities and absolutely new levels of development, research, and results.
And how accurate is it towards different ethnicities? Is it the same accuracy in everyone, or does it fall down sometimes?
No, we receive a lot of information from our device. Then it goes to the cloud, and there machine intellect analyzes and make a solution. Do we have a problem or we do not have a problem for our point of view? Certainly, when we work and study in real medical centers. We work with for example, the specialist in dermatology look for the situation, make his decision. We put our device, we receive some data, then we, in case of his decision was to make biopsy, we wait for results of biopsy. Then we compare the results of classical medical research with the things we see. And in that case, we're giving our intellect possibility to compare what we have and what the professional medical specialists study from this situation.
And you mentioned it a little bit there, but what was the clinical research that led to this technology, and what's the sort of scientific backing that this works? Could you give a sort of brief sort of description of that?
Actually, bioimpedance is very known technology. It's used already, as I said, in smart scales. It's used in smartwatches, and this technology is very good known. We do not make some I don't know, some experiment or something new. We simply take very good known, very safe classical medical technology and combine it with machine learning. Because it was very known, it was very good, the research of it and attempts to apply it to any medical devices was in Korea, was in Russia, was in Sweden. But they do not get any good results because they try to give it to doctor. And doctor actually do not need it. He have much more easy and understandable and instruments which can be used here without any big problems. And this technology, our I think main achievement, which we took this classical technology and because of it works with very big data, we give this very big data to someone mechanical who can work with it.
So really, it's working as that first detection point, and then from then, when it gives you a recommendation, that's when the clinicians come in and help. It seems like a very good sort of system to, and I can see how before it wouldn't have worked if they're given the data straight to doctors.
Yes, and also we have plans to make a medical device from it.
Mm-hmm.
But for that, for now, we have possibility to make a diagnosis. We really see many things which is possible to interpret like a diagnosis.
So is that using the same? Is that using the same technology?
Yes. Even now, we can see the changes. For example, the difference between, for example, melanoma or mesothelioma. Mm-hmm. We see the difference, but for now, we cannot give this information to person because we do not pass, and it's okay. We do not pass the real clinical expertise. And we need to pass it, and after that, we have such plans as to give more detailed diagnosis to our clients.
So when do you think it will be the possibility that this will give accurate enough diagnosis that you don't have to go to the clinician? Is that quite far in the future, or is that something you can see coming about?
You must go to clinic anyway.
Mm.
None of such technologies as ours can exclude professional medic from a system.
Mm-hmm.
We really do not want to become some kind of alternative for classical medicine. We just improve the possibilities of a person to receive a very early result, very early diagnosis, and also we can be very useful for classical medics because we can give a second opinion. When we will become a medical device, yes, every medic we spoke, he is interesting to give the correct diagnosis because medical also people they need much more instruments for this diagnosis. And then he medic then he work with a person. He have possibility to take second opinion right now when the person is behind him. It is very good for him. But no, never. I never believe in the project who can say we are who are saying that we are alternative to the classical medic. We just improve the situation. We just make it better, and even if we can change 1% or even half a percent of world statistics for such terrible diseases, I think it will be great success. But I do not believe to the persons who tell that we are making a better solution than today's classical medicine.
Yeah, well, I think that's a very sort of sensible approach to take, definitely. And I wanted to talk about a little bit about how you actually built up the company and the sort of the team that you have around you. So when did you actually start developing this, and how has it progressed over the years?
Oh, you see, I have very, very long story to this business. For a long time, I worked in banking business, in international investments, and so on. But I have very interesting background. My grandfather was the last president of Academy of Science of USSR.
Oh, wow.
So my childhood was. I spent my childhood around very scientific process, and yes, my father also worked this scientific research and developing. And when USSR blows, I have no option then because in science you have very few possibility to collect money, and I go to the banking business, to finance business. And 7 years ago, I decided to change my life completely. I go into cash and start investing in things which, for my opinion, is very important for humans. And I create this company. We spent several years getting the experience, organizing the team, and start to develop our project. We was very slow in our steps and very careful. This is not a project of 1 day or 1 week or 1 year. With 7 years, we work step by step to create a company which can produce and develop such devices. Because it is not only a question of science, it's a question of engineering, it's question of logistics, it's question to work with China fabrics. And for example, our great success, I think, when we start Kickstarter last year, and then we promise the date of delivery, we keep our promise. And even coronavirus, even cheap Armageddon do not stop us. We do it everything in time, and this is our great success, I think.
That's great. Yeah, I mean, not a huge amount of companies can boast that, sticking to all their timelines in such a chaotic year. And it sounds like you've got a really strong sort of science heritage, and the science community are definitely glad to have you in it. But yeah, so I mean, why is this technology so important? Obviously, skin cancer is an awful thing and so prevalent in the modern world. What sort of impact do you think that your skin tracker can have on such a big problem?
You see, first of all, we look at the situation not only from side of skin cancer. We're looking for the situation that we have a very huge amount of very good technologies that we cannot use because it is not very. It is too complicated to operate by a single person or by human brain. We now do same device for breast cancer detection. In early development, we have a device for lungs disease detection. We think that now the science and the science progress going to not in completely new technologies. There are a lot of people who doing that, and it is great. But for our opinion, we need to correctly apply and correctly take what we already have. It's much more easy than create something completely new. It's much more effective because you have very big experience and very big science base, which already has done. And now you need to simply create things. And the machine learning, it's a great boost to such work. We can now take care of a person not in the time when he visited a doctor. Cancer became younger, and it is very complicated to put a young person to a doctor every year. But we can do some things which will raise their chance to survive in the situation if they if they meet with such a terrible disease. We have a lot of people. Now we even prepare a special program on YouTube with stories of the people who meet a cancer, and most of all they are saying we met with we know we get diagnosed too late. Even couple of months earlier will be much better.
Mm-hmm.
And we trying to give them this little much more time to make the treatment more soft. Because there are today international medicine and ways of treatment for skin cancer, for breast cancer, they are amazing. Humanity make a great step in fight with cancer. But one of the things, the most important things, is to detect it as much early as possible. And that is why we cannot solve all the problem. But we are trying to make one small solution which can possibly help person to get much more chances in this surviving.
Yeah, no, you're completely right. I mean, time is essential in something like cancer, and early diagnosis can have just such a huge impact on that. It almost seems like a device that, it should be in every household. So how is your company scaling up to try and make that a possibility, to try and get that out as much as possible? Have you got plans to scale up in the immediate future, or is
Yes,
that
yes,
something you're still
certainly.
thinking about?
Yes, certainly. But you see, we have such plans. We have plans of getting an investment, international investment, and scaling the company. But we prefer to go step by step.
Mhm.
I personally do not like any revolutionary decisions. So we produced this year the first amount of devices. We already sold it to market. We receiving now every day the new data and the new information of how it is worked.
And I guess it's
Uh,
something that the more data you have, the better it gets at actually predicting these things.
Yes, certainly. And these things is the most important. We receive a lot of feedbacks. Most of our users are very open.
Mhm.
Especially, we have the huge amount of users who already met with melanoma, and they care about themselves. We already have and information about the correct that we can correctly warn people about the risk of problems with their skin and the risk that they really had melanoma, and this risk was confirmed by the official medicine. And this was the first stage. We enter the market. We give our devices to different people in different countries with different type of skins because the type of skins is very important. And the place you are living is very important. We receive a lot of new information for us. We make changes in algorithms and keep doing it every day. And now we prepare the second amount. We already producing 4,000 of our devices in China, and I hope that at the beginning of new year we will start the real commercial sales. For this, this first step was we do not make. Uh, Target to receive any profit. We make very limited amount, only 500, and to understand that yes, we was correct. We it works without the problems. We do not have any real information that we are not working anywhere. So for now, we after we have such results, after we sure then we are really work. Then now we are ready to talk with the investors and making plans for scaling and development.
Oh, that's brilliant to hear. And going back to a bit of a wider picture, obviously this is a new sort of breed of health tech devices for people in their homes. What do you see the future of health tech devices having on what impact do you see these devices having on the future of healthcare? Because obviously, see like continuous glucose monitoring and smartwatches are coming into play more and more in society. So I was just wondering what you thought about the future impact of these things on our healthcare systems.
You see, for my opinion, it's a great help for the official medicine.
Mhm.
For example, we work with different technologies. and we look for different technologies. If we take our devices, we can um, make visit to the doctor as much early as possible. So doctor receives patient with much easier situation. He can treat this patient, start treatment much more early than it is now. The other situation, it's that monitors and different other devices can help people with, for example, different cardio situations. For example, then even ambulance coming to person, it receives data not in the time when they come, but when they are going to him on the way, and we collecting this minutes. Globally, such technologies is not treating, but it's not providing any treatment to a person, but they gives him a time, the most vulnerable thing in our lives.
Mm-hmm.
And the future development of such things is to make the contact between client, the person, and doctor much closer. To give possibility to check different, absolutely different situation in our body, and make very complicated analysis to understand from very, very, very big data that, for example, in something in your process, in your body going wrong. And we can prognose that, for example, in 5 years you will get cancer. Stop doing this, and it will go back. I think it is the future, and I think even we will see such a future.
A lot of what we talk about on here is exactly that. It's all this data and this tech becoming helpful for not just curing cancer, but actually preventing things such as HIV diseases. And on that sort of line of thought, I was wondering, what else do you see that's inevitable for the future of healthcare over the next 10 years?
I think it will be a lot of instruments for self-diagnosis and for self-care. And I think for now we actually have two global ecosystems. One of them belongs to scientific or even big producing companies like Siemens, Sony, Samsung, and so on, who produce medical devices, and they all have their ecosystems. The other one belongs to Google, Apple, and others. And I think in very short future appears the next generation of ecosystem, which will be between them. Then very complicated devices as our mobile became some kind of health phone. I think even Steve Jobs in one of his last interview told about this. And I think we will see it in the next 10 years. The completely monitoring of human body by different instruments and devices, which is around us. And these devices will not become only communication and entertainment devices, but also devices for self-diagnosis and possibly even treatment.
And what do you think are the biggest obstacles that might actually get in the way of that future? And how would we overcome them?
I think everything is going fine.
Hmm.
Globally, we see that these projects like ours have very good interest from everything, beginning from governments to commercial structures. And if you're doing your job good, it is always easy to communicate with the people, and you had very good results. I do not think that something is staying between future and everything is sticky. Global technological company are interested in it. We see that in every smartwatch is now more and more medical functions. We see that there are a lot of international supporting programs which gives grants to the young teams who do not have first capital for it to try their ideas. I think now it's only a question of time. Because certainly each of such technology need to be very careful in operating. That is why we are not saying now about the numbers. We are not saying now about the diagnosis. It is not correct to say about it before you complete all stages of approvals. It is very important to even young teams to understand it is not staying between you and result. It is protecting you from making a mistake. That is why I think that everything is fine. You simply need to go and understand that if you're going to biotech, you're making a very long trip. And if you want, you have brilliant idea and want great results tomorrow, this is not fulfilled from you, for you.
Oh yeah, I completely agree with that statement, definitely. And is there anything else that you think I should have asked you, or that you want to share with us as like a final note?
As a final note, I would like to say that it is very great for me that we have such talk. We now have very good interesting for from many international journalists and specialists for our development. And I want to wish you a good luck, and I wish a good luck to any team who work now in such field as biotech. And I think this is most important field in the world, because you can fly to Mars, you can do anything in fintech and collect billions in your pocket, but your health and health of your close people is most important thing in the world. So such technologies for me, it's much more closer than anything else.
Yeah, 100%. And it's so fascinating to actually learn about the science of what you're doing. And I really hope the skin tracker can be a sort of pioneer in this field, because it seems like it should be, you know, in every home, because it can really make such a huge difference. And it's been amazing hearing about it in your plans for the future. So one last question is, how can people keep up to date with what you're doing?
Actually, we have a sales on our website.
Mm-hmm.
And I think in next year we have very low stock now, so we have about 100 or less than 100 of devices now in stock, and they sell very fast. And next year we will be able to provide a really normal stock, and I hope we will be able to sell it to every person who will like it.
Amazing. Well, again, thank you so much for speaking with us. It's been a brilliant discussion, and yeah, thank you for joining in and listening. So if you'd like to find out any more about what we're doing, go and check out the Going Life website, or you can check out all the sort of news and articles. But yeah, thank you again, Vasily. It's been an absolute pleasure.
Yes, same as pleasure. It was pleasure for me. Thank you.
Brilliant. Thank you very much, guys. See you later.
Bye bye. See you.